Self-isolation. What does it mean to completely stay in our shell and nest? Using our shell to retreat means that we stay away from others, even at home as best we can. Staying in our nest means that we stay at home and don't go out into the public. This self-isolation is called this because you are being trusted to stay in your shell away from others and to stay at home for 2 weeks. It's an inconvenience, but in the long run, it's worth it if you save someone's life. Think about your grandma, your mom, your best friend. Stay home for 2 weeks and keep them all safe. We keep hearing about people who are diagnosed positive with COVID-19, and they feel a lot of shame for exposing anyone, especially their loved ones. Only you can control what you do, and you are being counted upon, so this virus is suppressed by your actions. This virus is very contagious and spread from one person to the next very quickly, so practice protective measures is the healthiest, best action you can take to stop it. Self-isolation. When do we completely go into our shell and nest? You must stay home at your nest if you've returned from outside the country. Even if you went to Buffalo to visit your family, you need to stay inside and keep your distance in your shell away from other family members who did not travel there with you. If your family member or person you know has left Canada, even to the US, and you've been within 2 meters of them, you've got to nest at home. Same thing goes for coming into close contact with someone who may have or does have COVID. You need to nest and stay home and stay inside. Heck, they should have stayed home in their nest or in their shell away from you, as they would have been given instruction from Oswego Public Health to self-isolate. If you are waiting for COVID-19 test results, you would have been told to self-quarantine or isolate yourself, and this means you would need to do this by, again, staying in your shell away from others and at your nest by staying inside at home. Self-isolation. Why is it important for you to completely go into your shell and nest? Remember we talked about being asymptomatic, meaning you can be sick and not show any symptoms? Well, you could have the virus and not display any symptoms of the virus, yet infect others without knowing it. This virus spreads exponentially, meaning one person can give it to 3 people, and those 3 people can give it to 9 people, and those 9 people can give it to 27 people, and those 27 people can give it to 81 people. In this example, the exponent is a factor of 3. So the number of people that get the virus is multiplied by 3 times. So that's why, looking at the bottom row of people, you can see on the bottom of the screen, which is 27, this is multiplied by 3, giving us 81. This is just an example only. Since there's no cure, and it affects people differently, from mild symptoms like the flu, which is uncomfortable enough, to severe symptoms, you must stay in your shell away from other people you live with and stay in your nest by staying home so that this virus doesn't travel through you to multiple other people. This is especially important in a First Nations or Ongwe community, our community, because many of us live with multiple other people, don't always have all the water we need due to water deliveries, etc., and face other social and economic challenges, making us more vulnerable to health-related issues like COVID-19. Travel and visiting, especially outside Canada, is risky. We as people love to travel and to visit. Many of us have family outside of Canada, but right now, the U.S. has over 5 million people who actively have COVID-19. The daily rate of new cases in the U.S. is alarming, with over 40,000 new cases just on August 10th. That's within 1 day. You are taking big risks by traveling and visiting right now, or having family members come over to visit you right now. This is a hard thing. But to stop the spread of this virus and to keep our families and communities safe, we have to make sacrifices by replacing visits with virtual visits or talking on the phone right now. Remember, this isn't a sovereignty issue. Yes, we can technically cross the border, but that doesn't mean we should, especially if we put ourselves and family members at a greater risk. If it is for essential reasons like child custody and visitation or surgery, you need to contact Oswego Public Health or your local public health unit and inform them about your plan for 14-day quarantine when returning from the U.S. or abroad. We will soon get over this virus and we can visit and travel the way we once did, so be patient. Hierarchy of controls. The hierarchy of controls is a system used to deploy effective controls within an organization, workplace, or community to identify the most effective ways to control a hazard. Depicted within the inverted pyramid is the more effective controls on the large top side of the pyramid, whereas the least effective controls are on the bottom. The hierarchy of controls can be used to identify the best practices for controlling a person's exposure to SARS-CoV-2, the novel coronavirus that has led to the COVID-19 pandemic. Elimination controls. This is top dog and has the most hierarchy over other controls, which includes staying home, working remotely and avoiding public areas, staying off campus and avoiding occupied or public areas. Elimination controls are also avoiding use of shared equipment and spaces, having virtual appointments, meetings, site visits, and training through the use of web conferencing applications like Zoom or Skype, or video calls like WhatsApp or FaceTime. First, consider if it is necessary to be in person, then you can eliminate what you can to reduce your exposure. Examples where it is or may be necessary to be in person include healthcare workers seeing patients, food preparation, care services, and cashiers, to name a few. So what else in these situations can be controlled? Let's take a deeper dive into this. Okay, so for substitution controls, there are none currently identified, so we will move down the pyramid to engineering controls. Engineering controls includes the routine use of Health Canada approved disinfectants and to be effective disinfection procedures and protocols for facilities, shared equipment and spaces, work area, and personal electronics are needed. The use of barriers, partitions, ropes to separate employees from public or building occupants. For example, plexiglass screens, sneeze guards, theater ropes, posts on barriers, hazard warning tape, etc. These are all engineering controls. Other examples of this control measure is, if performing certain types of research, a biosafety cabinet might be needed, or having a certain kind of business allows you to set up a drive-through style operation or put in partitions and windows, then this is setting up your environment to serve or reach people while keeping distance as much as possible. Engineering controls means installing hands-free trash receptacles, soap and towel dispensers, door openers, and other similar hands-free equipment to reduce indirect contact exposure. Using handles or push buttons and other high-touch points made of copper or coated with copper tape, as COVID-19 has a low virus stability on copper surfaces, and research has proven there is no viable virus after 4 hours on copper surfaces. Create isolated spaces and workstations for employees or students with immune deficiency. Remember, these are all engineering controls. Administrative controls includes the use of social or physical distancing requirements of maintaining 6 feet distance from others. If you are unable to maintain distance, you shall wear a mask. Administrative controls are also using floor markings and other barrier types to promote distancing. Having cough and sneeze etiquette procedure, such as using your sleeve, is a good way to cover your sneeze or cough with smaller risks of contamination, even when you are alone and have taken off your mask. Administrative controls are also the practice of proper hand hygiene for a minimum of 15 to 20 seconds. And remember, hand sanitizer is not a replacement for good hand hygiene, so wash your hands with soap and water as soon as possible. This type of control is also using something called control procedures. That involves not touching your nose, your eyes, your mouth, or your face. deploying disinfection procedures for specific operations, facilities, and or work areas are all administrative controls. Note that administrative controls are near the bottom of the hierarchy of controls, with utilizing personal protective equipment of medical masks or gloving and wearing community protective equipment such as cloth masks falling beneath that, meaning that there are less effective ways to limit exposure to COVID-19 than elimination controls. Other protections. There are other things you can do to protect yourself. Getting plenty of quality sleep, eating well, exercising regularly, and keeping your mind and thinking healthy will not only keep you sane during this difficult time, but will help keep your immune system boosted. We don't always get all the vitamins and minerals we need from food, and to boost this as well as your immune system as flu season approaches, taking vitamins and supplements can only help you. If you're going to use medicines to help you and to boost your immune system, be sure to talk to a traditional medicine person or herbalist to ensure that you aren't using plants that will interfere with other medicines or your medications you might be taking, or to ensure that you are using the plants correctly and respectfully. Other ways to boost your immune system is by ensuring your immunizations are up to date and that you get the seasonal flu shot when it is available, as it can provide upwards of 50% protection. This is especially important since the flu is a respiratory illness and COVID-19 attacks the respiratory system. We are at the end of our training presentation. I want to thank you for taking your precious time for sharing your ears and mind. Stay strong, keep a good mind, stay safe, and remember the tools you may have gathered here today.
For those of you who would like to reach me, I can be reached at cec@sixnations.ca. As we say goodbye, here are some references for further information. Ona, stay safe.
Special thanks for information and research contributions to Fida Khan, Infection Prevention and Control Officer of Six Nations of the Grand River Elected Council Health Services. Fida can be reached at email ico@sixnations.ca.